Hello, my name is Blaze. I'm a nurse practitioner student at West Virginia University. Can you state your name and date of birth?
Yeah, name is Zachary Nybert and my date of birth is September 30th, 2004.
All right, so we had a nurse come in earlier. She did a real quick makeup on the patient. Blood pressure was 110/64, pulse rate was 58, temp was sitting right there at 97.3, and the respiratory rate was 16. Do you have any pain or discomfort right now?
Nope.
All right, today we're going to be doing the musculoskeletal exam. So the first thing we're going to get started with and do is the temporomandibular joint. Could you just kind of open up your mouth real quick for me? As best you can, wide. All right, so typically patients should be able to fit 3 of their own fingers within the mouth. That'll kind of indicate any swelling or anything like that if they can't. So first, I'm just going to kind of sit here and assess. Can you open your mouth for me? Close. All right, can you retract it, pull it towards you? Push it away from you with protrusion. All right, and then do a lateral movement like this. All right, perfect. I'm not noticing any crepitus or any abnormal movement sounds, no nodules or anything. Patient does have some facial hair. I'm not noting any redness, swelling, or anything that would look a little bit abnormal. I'm not feeling any pulsation or masses or anything like that in the general area. So everything looks good there. So next we're going to sit there and we're going to kind of inspect the spinal cord area here. So I'm going to have you kind of lean forward there. We're just going to kind of do a real quick inspection of the patient's back, looking like for scoliosis, kyphosis, lordosis, anything like that, and kind of sit there and assess kind of like the shoulder blades and everything as well. So not noticing any like redness or swelling that seems to be abnormal. Patient does say that he does like to play games throughout the day. So there could be a little bit of redness in his back from kind of sitting in a chair. So nothing seems to be abnormal. He does have some moles, everything like that. Skin's nice, even, distributed throughout. Not noticing any bruising or anything like that as well either. So I'm gonna kind of sit here and look up at the C7 point, which will be kind of the bony point up here. We're gonna start down there and kind of look down towards the gluteal joints, which the gluteal cleft, which we did just kind of look at right there. Everything looks good and equal throughout. So for the next portion of the exam, we're going to be kind of just looking for alignment of the shoulders and the iliac crest and everything like that. So could you kind of just stand up straight for me real quick? Stand up. All right, so the shoulders are nice and kind of equal throughout. No abnormal bulging, anything seems to be looking out of place or anything like that. All right, you can sit back down. All right, so for the next portion, we're actually just going to kind of do a real quick just palpation throughout the entire back. We are actually going to start here at the spinous process up here at the top, and we're just going to kind of feel around. I'm going to ask you if you have any tenderness or pain or discomfort throughout the entire portion of the back, okay?
Okay.
Moving our way down here towards the gluteal cleft. And then we're also going to kind of feel for the paravertebral muscles here on the sides. Kind of move our way back up. Any pain or discomfort that you're noting throughout this entire portion?
No.
All right, nothing, okay. We're going to kind of feel here on the sides. Okay, iliac crest right here. No pain or discomfort in this area?
No.
All right. So a patient didn't state any tenderness or anything like that. Also, I'm going to kind of sit here and look at the range of motion for everything. So we're just going to kind of sit here and look at the neck and the back. First, we're going to start with the neck. Could you sit there and put your neck down to your chest for me? All right, not noticing any movement or that would seem abnormal there. Could you kind of like flex your head back, kind of like this, and put it, okay? Any pain, discomfort, anything like that? So patient currently right now is moving without limitation. I'm gonna need you to turn your head to the left and right. All right, no issues. And then could you kind of just bend your head down, shoulder to ear on both sides as best you can? All right, and the patient's moving without any issues there as well. So not noticing any issues or anything like that. So for the next portion of the exam, we're actually going to kind of sit here and look at all the upper extremities, shoulders, arms, elbows, wrists, and hands, just kind of looking for any abnormalities, kind of swelling, anything like that, bruising, redness. I'm not noticing anything. Everything was equal bilaterally. Patients moving their hands. in motion, everything looks good. Got some increased muscle tone here on the shoulders and in the tricep area. Other than that, no bruising, scarring, anything like that. That would seem to be abnormal. I'll do a real quick look here as well. All right, patient looks to be in good shape. So for the next portion, we are going to kind of do like a real quick look at the palpation portion for like the shoulders. We're going to start up top first here, okay? Just going to kind of feel around the scapula up top. Could you just nice and relaxed, sit forward, nice, relaxed. Starting here at the trapezius, feeling for anything that would be abnormal. Right now. You're not having any pain or discomfort in any of this?
No.
No bony prominences, masses, or nodules, anything like that. So for the next portion, we're just going to kind of do the same thing for both elbows. All right. Feeling the nice tendons and everything like that as well. Everything seems to be in place. No extra bony prominences, anything sticking out like that. Do this side real quick. Going to kind of move down to the hands, kind of palpate here on the wrists. Then we're going to look at the metatarsals here. No abnormal bony prominences, anything like that would be sticking out. All right, so for the next portion of the exam, we're gonna kind of sit here and just do a real quick range of motion for all the portions as well. So we're gonna kind of do with the shoulder real quick. So I'm going to have you do some abduction and adduction. So if you could just kind of raise your arms up like this, kind of put them back like this behind you, perfect. No limitations or anything like that. I'm also gonna kind of have you just follow me, do the right arm behind, kind of like you were doing this back in grade school. Other arm. And this sits here and looks at internal and external kind of flexion and everything like that. You can put behind the back for the other one. All right, everything looks good. Can you raise your shoulders up to the sides? No issues. All right, perfect. Everything looks good there in the regards for the shoulders, for abduction, internal and external rotation and everything like that. So for the next portion, we're just gonna kind of have you sit here and put your elbows up at a 70-degree angle. All right, we're also gonna kind of sit here and look for abduction and everything like that here as well in this portion of the video. So we're going to kind of just do an extension real quick on both arms. All right, supination, just put them out like this. Pronation, back down like that. All right, perfect. Everything looks good. No limitations there as well. So for the next portion of the exam, we're going to sit here and kind of do the same thing with the wrists. So if you could put them pronation, and then can I also have you go in, out, all right, up, down, no issues like that. Can you go like this? So normally for this, we would hold for a minute if the patient has any pain, discomfort, or we could even do it like this as well. So for the next part, we're just gonna kind of sit here and look at the hands as well. So for this, just gonna kind of have you touch thumb to fingertip on each hand for me. All right, can you flex your hands? Extend your hands out as best you can, shake them around. All right, and I'm just gonna kind of sit here, play with the thumb as well. Abduction, adduction for each, spread each finger apart, see if anything is a little abnormal. Everything seems to be moving. And throughout the entire exam, I'm not noticing any crepitus, anything that would seem to be abnormal for this portion as well. So for the next part, I'm gonna kind of sit here and look at the lower extremities. If you could stand up for me, that would be appreciated. I'm gonna have you walk towards that way, if you could. All right, and back towards me. All right, and you can go and sit back down. So for this portion of the exam, I was just kind of observing the gait. Big thing we're looking at for in this portion of the exam is kind of just like if there's any balance issues, anything seems to be abnormal. Gait seems to be normal and for the patient's age and health. So I'm also gonna kind of do a real quick assessment of the extremities here. The lower extremities, everything seems to be bilaterally equal. Not noticing any swelling, any abnormalities here at all. Just gonna kind of feel around real quick, look around. Yeah, patient does have hair, no swelling, redness, bruising, anything that would be kind of indicative of an infection or any problems like that. So For the next portion, I'm just going to kind of palpate all the bony prominences here, just as we did up top. Feeling for anything that seems to be abnormal, which I'm not feeling on the left knee. Do your right knee. Not feeling anything. Kind of go back down here to the ankles. We'll do the heels. Nothing seems to be protruding or anything anywhere. Patient's feet are a little bit dry and a little bit cool. Clinic is cool, so as to be expected. I am going to kind of just palpate through all the muscles, tendons, if you don't mind me doing that as well. I'm going to kind of start up here on your thighs, feel for the quadricep muscles. If you have any pain or discomfort through any of this portion of the exam, please let me know, okay? Going to kind of feel back for the back of the knees for the popliteal pulses and the ligaments back here. Popliteal pulses are palpable. Going to go down through the calf muscles. You don't have any past history of any medical injuries or anything like that from sports back in high school, college. All right, so I kind of just palpated the bony prominences, ligaments, muscles. Everything seems to be nice, intact, and as what we would expect for the patient and his age range and health. So for the next portion, I'm just going to kind of palpate the iliac crest for any bone deformities, any joint or crepitus, or any extra warmth or anything that would be kind of abnormal. Iliac crest are right up here. I would say no increased warmth or anything that seems to be abnormal, no hernias that I can feel in any areas that would be of concern as well. All right. So for the next portion, I'm just going to kind of sit here and look at the knees. I did palpate for sponginess, crepitus, everything like that. No bone growth that seems to be abnormal, no Baker cyst that I felt in the knees as well. All right. So for the next portion, just going to kind of sit here and do some range of motion in the hips and everything like that, okay? So we're going to have you go over here to our exam table, which will be the couch. All right, if you could just lay back down for me. So I'm going to kind of sit here and do this with both legs. I'm going to kind of just sit here, prop it up. All right. Kind of go straight. We're going to do the same for this one. All right, so everything's moving towards midline real well. So we did kind of like, can you also pull your knees up to your chest for me real quick? Just kind of do a little quick flexion. Everything looks good, not noticing any cracking, crepitus, anything like that. So we did abduction and adduction. We also kind of did a real quick internal and external rotation as well. So everything looks real good there. Doesn't seem to be any issues. Do this one more time. Okay. Not noting any crepitus, any range of motion issues either as well. Everything seems to be nice, intact, and flowing well. So for the next, we're just going to kind of do knees, which will be the flexion portion. So for flexion, we're kind of just sitting there. We're going to kind of pull the knee up to the chest, and then we're going to kind of straighten it. And then we'll have you kind of stand up and just do a real quick deep squat, okay? All right. Pull this all the way up. All right. Not noticing any popping, anything that seems to be abnormal. All right. Flexion, and then could you kind of just elevate each leg real quick and just straighten it out as best you can? Straighten that. Perfect. Flexion, extension, everything seems to be looking good. So next, I'm going to kind of have you pull around here and stand up real quick. Just going to kind of have you do a kind of a deep squat in a sense, just to kind of sit there. All right. Perfect. And you can stand back up. So what we did with that was we kind of just looked at internal and external rotation, or extension. So internal and external rotation will be next. I'm gonna have you go on the exam table and I'll place my hand on your thigh, stabilize the femur. And I am going to kind of move everything to the medial aspect. All right. Okay. All right, everything's good. Not noticing any popping, no pain, discomfort, anything like that. All right, so for the next portion, I'm just gonna kind of look at your ankles real quick so you can kind of sit back up here. And then we'll have, well, actually, you know what? Let's have you stand back up. I'm gonna want you to walk on your toes for me real quick. Walk on your heels. Okay, you don't have to do it backwards, but that's just excellent. No balance issues or anything like that. All right, I'm gonna want to have you walk on the lateral side of your feet there. Perfect. Walk on the medial aspects as well. All right, perfect. Not noticing any issues with any ankle motion or anything like that. I'm gonna have some dorsiflexion and plantar flexion. I'm gonna have you sit back down. You can angle this way too if you want. Doesn't matter. I'm gonna kind of sit here and assess. Pull your foot down, plantar, dorsi, plantar, dorsi. Kind of sit here and rotate it around too. Not noticing anything there with the ankles. Everything seems to be nice flowing, not noticing any issues there as well. And then we kind of just did like a real quick inversion and adversion. And then we're gonna look at the feet real quick. We're gonna do kind of an abduction and adduction. So we're gonna kind of just stabilize your heel and we're gonna move the foot medial. Okay. And then do adduction, pull out, pull out, all right. Not noticing any issues, no pain or discomfort in any of your feet here.
Nope.
All right, kind of sit here through the toes, make sure everything's kind of moving a little bit as to be expected. You kind of flex your toes for me, flexion, extension, flex them out there for me. All right, perfect. And after that, we are concluded with our exam. Thank you.